Thank you, Emma. And thank you, Vicki. And thank you for inviting me on this particularly auspicious day, the launch of the center. I think it's my third or fourth time visiting Edge Hill, and I'm never sort of short of amazement at how it is the complete antithesis to New York University's campus. The complete antithesis. It's quiet, there are bunnies, it's just unbelievable. And you know, I was thinking about the bubble gum and just, you know, having a flash of our experience in the height of COVID and how we've got a really quick sign that we are after that, a room full of people blowing fake bubbles into a room at each other, celebrating the traces we leave on each other. May we continue to bask in that reality. All right. Right, so I'm joining you, as Vicki said, I'm joining you from the land of the Lenape people, and specifically New York University, where I direct our graduate program in drama therapy. And Vicki mentioned some of this already, chair our Creative Arts Therapies Consortium, which established and hosts the Creative Arts Therapies International Research Alliance, which Edge Hill is a member. I'm also joining you from the Arts and Health at NYU, which I'll tell you about shortly, and the Jameel Arts and Health Lab, which you would have heard Neil speak about yesterday. And for those who've just joined today, I'll do a little bit of recapping of yesterday as it connects to this talk well. So I mentioned the Arts and Health at NYU because that's the unit that co-produced with University College London a conversation series called The Spaces Between, which feels to me very much like it extends the panel conversation yesterday while also offering additional perspectives to one of the questions that came from the audience as Niels was speaking yesterday about how amidst all of the wonderful research and practice on the health benefits of the arts that we're engaged in, and all of the wonderful examples of practice that we bask in, how are we really addressing, how are we actually addressing real issues regarding diversity, equality, inclusion, and belonging? And before I continue, I'll just say that I got a bit carried away with the QR codes. So feel free to have your phones out if you like, and especially if you like to gather resources as they come up. So as I was mentioning, the series was produced by colleagues at UCL, who I'll introduce in a moment, and I collaborated with on a UCL Grand Challenges bid, which emphasizes cross-disciplinary collaboration within UCL and with external partners to address a range of significant social concerns such as human well-being, sustainability, equality and justice, as well as others that map on well to the 2030 Sustainable Development Goals. And UCL partnered with us at Arts and Health at NYU, which is a large university-based network of labs, like the NYU Creative Arts Therapies Consortium, the Nordorf Robbins Music Therapy Center, the Music and Audio Research Lab, our Theater and Health Lab, our Langone Medical Humanities Program, as well as individual researchers and practitioners engaged in research and practice, curricular and policy development on the health benefits of the arts from across 3 of our degree granting campuses and 12 satellite campuses, which you can see up there. So I know NYU has a pretty significant footprint. These are just a few of the examples of studies that are reflective of cross-school collaborations, transdisciplinary collaborations. The first music upper limb integrated therapy with Russ Rehabilitation in our medical school. A balance test, which actually was just launched, which looks at the sensors that we carry around in our phones and how we use that to assess sway. And it's a collaboration with physical therapy, a collaboration with art therapy in our medical school as well on Parkinson's disease. And then in drama therapy, we are doing a range of different studies. One is focused on the role of drama therapy in sustainable creative practice, specifically stress reduction amongst acting students. So those are just a few examples. So my collaborators at UCL are Phil Jones, who's a drama therapist, as well as Professor of Children's Rights, Wellbeing, Children's Rights and Wellbeing at the Institute of Education. And you can see some of the other bio notes from my other colleagues, Professor Amma de Graft Akins, Dr. Deborah Padfield, from different departments across UCL. And in planning for the series, our conversations oscillated between an attention to communities of concern that often fall out of focus and remain under-resourced, and the many arts practices that make up the constellation of what we refer to when we're talking about the arts and well-being, while at the same time acknowledging that in different country contexts, the spaces between artists working in care settings and creative arts therapists, for example, vary depending on professional recognition, articulated identities and scopes of practice, and training options. So this led to the title, The Spaces Between. So in the Spaces Between, we asked 14 groups from across 10 countries working on the health benefits of the arts to consider these questions in purple and to prepare their responses in the form of a brief catalyst, a presentation, a workshop, or a paper, followed by a conversation. And we've hosted 9 conversations so far, once a month, including one just last week in which Suprita Aital, Vicky Karku, Sean Liverpool, and Emma Paris shared some of their research on the role of the arts with helping professionals, which I know they're going to be sharing later today, so I won't give any other further spoilers, maybe just a little bit later. So all of the past conversations are recorded and archived at the link available through that handy QR code, and I will share a link for upcoming talks towards the end as well. So for now, what I'd like to note, though, is that as I've been looking back on these conversations so far, I also see that we've been asking ourselves a question that came up several times yesterday and that remains relevant for us today, of course. So how should we move forward in our efforts to investigate and integrate evidence on the health benefits of the arts in health and care work while keeping health equity at the forefront of our organizing? And I really appreciate that the Research Center here has named this as a priority. It certainly has been a question for us in the Jameel Arts and Health Lab. So just to recap very briefly, yesterday we discussed health inequalities as unfair and unavoidable differences, differences in health across the population that vary between groups, different groups within society. And health inequalities arise because of the conditions in which we are born, grow, live, work, and age. And these conditions influence our opportunities for good health and how we think and feel and act. And this in turn shapes our mental health, our physical health, our well-being, our social health. So this calls for interventions that focus on treating place and not just people, and approaches that engage communities, not just clinics. Place-based approaches to care, as Vicky was sharing yesterday, attempts to link up partners and services around specific populations. And this was reinforced yesterday, as was the importance of funding, scaling up training to other care providers, laypersons, and artists, scaled research, increasing happiness alongside efforts to reduce distress, and most importantly, centering the lives and the experience of lived experience experts. So what I'd like to share with you now is just a snapshot of 2 major themes that came up through a few of the conversations held thus far. So not all of them tackled this question, but those that did offer some hopeful possibilities. And some of this is my analysis, but I've also drawn on the shared analysis of people who've participated in the series, either as audience members or as speakers so far, who have been sharing some of their thoughts online through an online Padlet, which is linked there through that 5th QR code, right? So that, and you're welcome to check that out and also contribute to it based on this conversation today if you like. So the first theme had to do with vocabulary, the language we use for pain, for care, for practice. Consider the last time you had a headache or a toothache. If that pain were an image, what kind of image would it be? And if you're comfortable doing so, I'll invite you just to turn to a neighbor and just share the fragments of that image. It may not be completely cohered at this moment. It may not have cohered, but maybe there are some glimpses of it that you see. So I will look forward to hearing about some of these images later, but I'm going to show you a few that were co-created by a number of folks around the UK, as well as Japan and India. So Deborah Padfield, one of the series hosts, she enters into collaborations with people to support them in the search for a visual language to better describe their pain in order to create a shared space, the picture, from which communities and care networks or patients and providers can begin to explore the meaning and experience of pain together by using that concrete, tangible image. They have a reference point. In the creative arts therapies, we often refer to and think about the third space that the arts provide, and that's what's happening here with Deborah's work. So she's worked with people with chronic pain in 2 medical collaborations in the UK and has now extended her work, as I said, in partnership with colleagues in Japan and India to work with people living in chronic pain. And they co-create photographic images which reflect their unique experience of pain and its impact on their lives to try to make the invisible experience of pain more visible. This particular QR code links to a free book in which she's written more about this and has offered more examples. And now I'm realizing that if I just flit away from the slide, nobody will get a chance to catch that. But I think that this is also recorded and will be available online, so you can always return to these resources. So in another project, Dr. Maitri Gopalakrishna and Devika Mehta Kadam noticed that most creative arts therapists in India come from upper caste or class urban backgrounds and are trained in approaches to psychotherapy established in Europe and North America for the most part. They contrast this reality with the diversity of artists, care workers, and anti-oppression practitioners across the country who do meaningful work at the intersection of arts and health, and use this reality as a starting point from which to explore how hierarchies of care, who is authorized and who is not, who is the doer, who is the done to, work against the pressing need of promoting health within a large population. And they began by asking us to consider when we feel cared for. So here's another question. What was the language of care for you in your childhood years? I'll just give you an example of my own, then I'll ask you just to reflect on this yourself or perhaps with the partner who you were just chatting with. So my mom will ask me if I've eaten. And more often than not, she'll ask me if I'm drinking enough water. And that's her love. And when I was a child, it would involve rubbing Vicks Vapor Rub on my back and on my chest, and then putting it into a pot of boiling water and putting my head over it and covering it with the towels, so none of that menthol steam would leave. And I would find it torturous for a little while, and then I would just give up. And maybe that's just, an analogy for my entire relationship with my mom, but that's another keynote for time, But it was love and it was care. And I'll just ask you to reflect on that question for a moment. What was care? What is care for you? What does that feel like? What does that look like? What was it for you as you were growing up? All right, I'm going to start to invite you back. Just find a resting point in the conversation. And I know this isn't entirely fair to the online audience that might be joining us, but can I ask anybody in the audience, if you don't mind raising your voice a little bit, just to give us one example? One example. Yes?
We were just talking about how sometimes your care is shown without actual verbal language. So
yes.
My dad used to bring little gifts home for me from his work.
She was saying sometimes care is shown without verbal language, like her dad used to bring little gifts home from work.
Yeah, but he never said I love you.
But he never said I love you. Yes, up there, hot. Accepting unconditionally, and just that feeling. Yeah, my mom also put honey in brandy, which was my favorite kind of love. So, yes. Oh. If you didn't hear it, her mom used to warm the clothes in central heating. Thank you. One more? Yes? Such a cultural difference between here and Brazil in terms of physical touch. Absolutely. I just had the pleasure of being in Rio this past March, and I thought, my God, everybody loves everybody. We're just touching everybody all the time. It's just, oh, wow. I don't have this on slides, but another project I did with humanitarian aid workers, I work with the Harvard program in refugee trauma as well. And every year we would take 60 humanitarian workers to Orvieto, which is this gorgeous town, if you haven't been, about an hour north of Rome, if you have the opportunity. And every year I would ask them to bring a photograph of what constitutes a healing environment for them. And they would, so I collected these photographs, and after about 10 years, I had, 600 photographs. And so myself and another colleague of mine, Oscar Palacio, photographer, we started to engage in a visual analysis of these photographs, looking for if there were themes, what might those themes be? And can you guess what the most prevalent theme was in these photos? Touch, trees, food, touch, trees, food. Not quite in that order, but very close. It was trees first, it was nature, and then you had communities of people, and those communities of people were engaged in all kinds of different things, often making or sharing a meal. And then there was a third set that seemed to be about particular practices, like they were engaging in yoga, they were engaging in art, they were engaging in something that elevated a sense of joy, but also constituted a healing environment for them, restored them. And so inevitably the question arose, how is it that we derive our, this is what sustains us, this is where we derive our energy, and yet for the most part, most of us work in very sterile, small rooms and expect healing to occur. Right? And for the humanitarian aid workers, often they aren't in rooms. They're often in very difficult circumstances where there aren't rooms to be found necessarily. However, the question was still relevant. If we resource ourselves through the woods, through natural encounters, through making a meal together or taking a walk together, why is that not part of our vocabulary of care? And so that's what Maitri and Devika were getting at a bit in their work. So they later worked together with drama therapist Arjun Khera, who's here with us today. Where are you, Arjun? There you are. Okay, so people go speak to Arjun about this wonderful project later on. And they created a film together exploring the language of care amongst South Asian members of the queer community living in Bangalore. I consider myself a member of this community, though I don't live in Bangalore, but South Asian queer, yes. The name of the film is Kalaji Nagara, which translates to Care or Concerned City. It was directed by Maitri Gopalakrishna and Debusmita Dam, and based on groups facilitated by Arjun, in which community-based drama groups recreated the stories that this community sent in anonymously about their experiences of sex and sexual health. And I mention this because in a moment you'll see a short 1-minute clip, and you'll see labels like love language and sexual assault on a date, but these were themes that arose and that were present in the stories that were sent in. They were also asked about how care was experienced and understood. And Arjun, in your words yesterday, I quote, really simple things like making food for a loved one, or rice pudding, or wrapping a colorful sari around a queer friend were identified as acts or languages of care that were embodied by this drama group, and importantly, understood by other members of the community. We understood each other. This was how care was being communicated. Members experienced it as a kind of, you know that I know that you know I care for you, end quote. So I'm just going to play a short clip of this.
ಎಷ್ಟು ಉಪಯೋಗಿಸ್ಕೊಳ್ಳೋಕ್ಕಾಗುತ್ತೆ ಮನಸ್ಸು ಬಿಚ್ಚಿ ಅದನ್ನು ಉಪಯೋಗಿಸ್ಕೊಳ್ಳೋಕ್ಕೆ ಪ್ರಯತ್ನ ಮಾಡಿ.
Thank you, Arjun, for sharing that clip. This literally came together yesterday when we were talking about this project, and he said, you know, if I could prepare a clip for this, so thank you for that. I'll move a little quickly now. I know that we're coming close to the end. So in other talks, Laura and Sanna from Finland reviewed the conceptual terrain of practice and the many ways in which we describe what we do in the arts and health, arts for health, artists in health settings, arts therapies, and attempted to tease out a continuum of practice that accounts for the spaces between these bodies of knowledge, but also brings them into relationship with each other. I know that within the WHO report that Niels referenced yesterday, various continuums are presented to examine receptive to active engagement with the arts, and we've since been using the language of general to targeted care, or general and targeted arts-based approaches to care, in which going to a museum, for example, or an art class might constitute a more general engagement, whereas participating in a committed or intentional drama therapy group or targeted programs such as Dance for Parkinson's would be more targeted towards specific needs. And I know that Vicky Suprita and their colleagues have done some wonderful work teasing out tiers of care, which they're going to be speaking about. The second major theme had to do with accessible knowledge, which I'll just cover quite briefly. And here, with people in Latin America, with people managing anxiety in Australia, as co-production with children, youth, and in care. Professor Agustin Ibanez, who's the director of the Latin American Brain Health Institute at the Universidad Adolfo Ibanez in Chile, and an Atlantic Fellow with the Global Brain Health Institute at Trinity College Dublin, noticed the gap between the growing evidence for the arts on brain health and the essential gaps in basic knowledge and awareness across Latin America, which limited the reach and impact of creative methods. So as a result, he did two things. He created the Latin American Creative and Arts Intervention Network, which aims to support projects and online communities promoting the use of art to improve brain health and create support communities that experience greater vulnerability. And he also launched artsandbrain.com to collect case studies on the role of the arts in brain health, from which to form the basis of more rigorous clinical trials. And I got tired of the QR code, so there's the website. There's the website. Yeah. Professor Jill Bennett, director of the Big Anxiety Research Center and founding director of the Big Anxiety Research Festival, Dr. Carolyn Lynette and Dr. Marie Higgins spoke about the Big Anxiety, which I understand is one of the world's largest festivals of arts and mental health, bringing together arts and health experts to advance trauma-informed and lived experience-led approaches to mental health. So they spoke about the key principles behind the Big Anxiety, highlighted a range of experiential programs and immersive media environments that were created in partnership with communities. And one of these was Womanyani, a VR network, or VR artwork rather, created by Anagu artists in the central desert of Australia for use in remote communities looking to find ways to discuss trauma and suicidality. I'm going quickly here, but I welcome you to take a look at those talks in depth where you can hear more about these different examples. And finally, in this area, I would like to include the work shared by Phil Jones, Donna Betts and Val Hewitt, as well as Katie Warren and Laura Wright, about the co-production of research and care. And we did hear about co-production a bit yesterday, and in this context, co-production rests in the belief that each participant in clinical treatment and research should have the equal right to express themselves and take part in the process of bettering personal experiences of participation in the arts therapies, arts and health, and their effectiveness. So Betts and Hewitt laid out findings from their recent book on this topic. Amongst these, they noted that although many artists in health have genuinely co-produced projects with their clients, co-production is sometimes not done in a meaningful way. Many arts therapists worry about the impact on boundaries, on roles, dynamics within the therapeutic relationship, and of course, co-production can also be challenging and time-consuming, and this creates barriers for artists in health within smaller organizations having to meet cost-effective project deadlines. Warren and Wright demonstrated the ways in which they facilitated participatory action research within a dance youth program, and Phil Jones discussed the use of arts-based approaches in enabling children to participate more meaningfully in research about their experiences of therapy in particular. So of course, there were many more themes that we could explore and several talks that I haven't had the time to discuss, But the vocabularies and the overall project of making knowledge and care practices accessible and meaningful to a wider public emerged time and time again. So here are just a few more of the upcoming talks in this series, and apparently I had enough inspiration to have another QR code there, so you can find the talks and the links to join them. There isn't really a registration, it's just a direct link to join the talks at the times that they're identified. And then the link to the recording of those talks will just be made available on that website, so you can always go back and revisit them. My colleague Savneet Talwar, Karen and Tony Wright will take the concept of well-being and discuss it from a critical feminist perspective, problematizing some of the well-known arguments around moving forward with a well-being paradigm. Leanne and I, another drama therapist here. Leanne, are you here today? There you are. We were having a conversation as we were waiting for coffee, I think yesterday, about offloading to the third sector and the downside of what it means to, on one hand, recognize that we've got overburdened and under-resourced health systems, and we've got an underutilized resource in arts practices, and artists, and cultural institutions. And there is a relationship, as we all know, to be forged there, and that we've been celebrating that. But is there a more difficult side to this as well, in terms of the shifting of responsibilities? And so I think that's going to come up a bit in Savneet's talk. And then a wonderful colleague of ours, Kunle Adewale, who started the Arts and Medicine Fellowship in Nigeria, but it's now Pan-African, and in fact, the last time I visited it has gone global. We'll be talking about championing arts and health across continents and cultures. Kunle Adewale is also the inspiration behind the first Global South Arts and Health Festival, which will launch this year. It's a decentralized festival. It's a kind of an Olympic model. Their central hub will be Alexandria, Egypt, and then it'll take place across Latin America, Africa, and Asia, with country leads in each space. And I know you can find more of that online. And then lastly, myself and my colleague Maurizio Salgado, as well as colleagues from across the world, from 6 WHO regions, will be talking about a resource on arts practice and the ethics of care. This picks up on, in the height of COVID, the WHO had put out a resource called Basic Psychosocial Skills, essentially for lay people, for COVID-19 responders, but that meant all of us, right? What are some of the basic psychosocial needs that we all need to be able to respond? And Vicky, you mentioned a little bit of this yesterday in terms of training for trainers, in terms of capacity building. So this guide was getting at that. And in my conversations with colleagues at the WHO, we had a conversation about, what does this mean for arts practitioners? What does this mean for artists? And so we've put together a group of people from across WHO regions, artists, arts practitioners, arts therapists, who are thinking about this question of how do you care for and how are you cared for in the delivery of socially engaged creative programs? So how are we caring for artists involved? What are some of those psychosocial skills and the ethics of engagement that we need to be keeping at the fore? And I've put this little screenshot up here because in the UK we've partnered, I'm looking over at you, Alex, with the National Centre for Creative Health and our colleague Julia Puebla-Fortier, who is the UK representative to this project, in opening up a consultation. So you can see the 2 dates for the public consultations are June 23rd and 29th, and there's a QR code there, or you can participate through an online form at any time, and there will be other consultations in other parts of the world as well. So I'll end there. This project is, just in its bloom, so at another time, maybe right here, I'll have a chance to share more on it again. But for now, I'll bring this to an end. Thank you so much for the invitation again.